Hello, this is Anuja Matthew. Today I'd like to talk about super spreading events and COVID-19. What is a super spreader? This word is a generic term for an unusually contagious individual who's been infected with disease. This is not a new term. Super spreading or a super spreader has been shown for multiple different infectious diseases. An example is Mary Mallon, who was born in the late 1800s and into the 1900s. She was a carrier of Salmonella typhi and had a history of typhoid fever. She was born in Ireland, came to New York as a cook in wealthy households and was responsible for transmitting Salmonella typhi or typhoid fever to over 100 different individuals. So the vast majority of people who are infected with a disease infect very few others or none at all. It's typically a small minority of individuals who aggressively spread the virus. It's not clear yet why someone is a super spreader, but a super spreader, if he or she is in a closed space with poor ventilation, in a crowded setting, and in close contacts with others, enhances the chances of transmitting disease to other individuals. There have been multiple reports of super spreading events related to SARS, MERS, and now COVID-19. This is an example of a super spreading event after choir practice in Washington State in Skagit County. 61 members of a 122-member choir were in attendance. There was only, at that time, one member who was showing cold-like symptoms. 3 were eventually hospitalized, 2 of them died, but over 87% of this group developed COVID-19. The median age of the people attending the choir practice was 69 years old, and most of these individuals developed symptoms 1 to 12 days after the practice. So it was very clear that based on exposure at this choir practice, that a large number of individuals developed COVID-19. Transmission of SARS-CoV-2 in many cases have been associated with large gatherings. So in churches, as I just spoke about, or on cruise ships, or in homeless shelters, or in extended healthcare facilities, etc. But transmission then is dependent on time series evidence. So people attend a gathering and, a week or 10 days later, a large number of people who attended the gathering end up being sick, and then they test for COVID and they're COVID positive. But I think definite evidence can come from genomic studies. And what I'd like to talk about today is a manuscript that has not been published yet. It's been submitted as a preprint, but I thought it was a very important article trying to analyze SARS-CoV-2 spread in the Boston area very early during the outbreak. And it highlights the role of the super spreading events that are devastating to the community. So in this manuscript, they took nasopharyngeal samples from a large number of cases obtained from the Massachusetts Department of Public Health and the Massachusetts General Hospital. And this captured all of the early cases. So in late February, March, and April of 2020, they did sequencing and analysis of the SARS-CoV-2 positive samples. They were able to obtain several hundred high-quality SARS coronavirus genomes from over 700 individuals, and also an additional number of high-quality partial genomes. And based on these genomic sequences, they were able to make some conclusions that are very important to understand superspreading. The authors were able to identify SNPs, and SNPs are single nucleotide polymorphisms, and they're the most common type of genetic variation, and each SNP represents a difference in a single nucleotide. So they were able to identify SNPs in the viral genome sequences and compare it to 4,000 genomic sequences that were already available in a global database. So they created a phylogenetic tree, and in a sense then we're able to compare sequences from Massachusetts to the rest of North America, to Europe, Asia, and looked to see how similar they were in terms of SNPs. They also developed a model to look at where these strains were imported from. So they were able to identify strains that were originally not seen in Massachusetts and compare it to strains that were eventually seen in Massachusetts. And this was timed. So they looked at sequences that were obtained during the early, the middle, and the late stage of the first wave of the Massachusetts epidemic. And as expected, in the very early stages, most of the sequences were not local and came from North America and Europe, and some from Asia. And towards the middle and later phase, that the imported strains then decreased. However, local strains were also seen early in the first wave of the epidemic, and these local transmission cases increased during the middle and late stages of the first wave of the Massachusetts epidemic. The very first case of COVID-19 was identified in a traveler who had returned from Wuhan, China. It's not shown here, but the sequence that was identified in this individual clustered very closely with sequences found from other strains in Wuhan, China. And it did not match strains that were subsequently found in Massachusetts. The second and third cases of COVID-19 in Massachusetts came from two travelers who had reported traveling to Italy and Switzerland, and the sequence from their strains appeared to match very closely to other sequences isolated in Europe and not with sequences of strains isolated from China. Since these individuals were identified very early and forced to quarantine and contact tracing efforts were elevated, these strains were not then transmitted and they did not spread to other parts from the first known introductions into Massachusetts. There was an international business conference late February in Boston of a biotech company, where it was known that after that meeting, there was evidence of over 90 people coming down with COVID. So people came from different parts of the world, attended the meeting, returned to their homes, and transmitted COVID-19 within Massachusetts, outside of Massachusetts, in different states within the US and back in Europe. So there was clear epidemiological evidence that this was a super spreading event. But in this manuscript, the authors had access to genomes from 28 of these cases, which allowed them to look for genetic evidence of super spreading. And you would see genetic evidence of super spreading if you have clustering of identical or highly similar viruses within a narrow time frame or time window. So if you look here, there was a single nucleotide polymorphism from a C to a T in position 2416. Many of the isolates, or most of the isolates from the conference, had the C to T mutation, and they all clustered together very closely, defining highly similar viruses, and it occurred in a narrow time frame. So once people got infected, they were then transmitting viruses to the same strain of virus to different parts of the country and internationally as well. So the authors then looked back at the C to T mutation in Europe and found that there was very low level community transmission of this mutation in Europe in February. So they came to the conclusion, based on all the genetic data that they had and sequences that they were able to obtain and compare, that it was a single introduction of this allele into Boston, and after it came into Boston, it was amplified by super spreading at the conference. The specific viral sequences containing the C to T allele C2416T allele subsequently spread extensively in the Boston area and represented about 35% of the data set that was sequenced by the authors. And in March, this allele then appeared in multiple other cities because people who attended the conference then went back to their places of residences and then also spread to other countries and increased steeply in frequency in domestic and global SARS-CoV-2 genomes in the database obtained or collected through June 28. The specific viral strain that was isolated in several members who attended this international business conference in Boston subsequently found its way in a Boston homeless shelter in staff and guests who attended the homeless shelter, a skilled nursing home facility in the Boston area, and then it was exported to other domestic and international sites. So the authors conclude that their findings repeatedly highlight the close relationships between disconnected groups and populations. I think it also illustrates the role of chance in the trajectory of an epidemic. This happened very early when we didn't know much about SARS coronavirus 2. We didn't have as many extensive preventive measures. And it provides direct genetic evidence that super spreading events could profoundly alter the course of an epidemic, and implies that prevention, detection should be a priority for public health efforts. So while this paper has not been published yet, it's a very important study and hopefully will be published soon. If you need more information or more details, there's plenty of additional figures and graphs that I didn't go into, but I thought this would be helpful just to summarize the data to highlight genetic confirmation of super spreading events with COVID-19. Thank you again for your attention.